How the ban harms the mental and physical health of trans kids who need gender-affirming care. Gender-affirming care is a term that encompasses various medical treatments that help transgender people align their bodies with their gender identity. These treatments can include puberty blockers, hormone therapy, and surgery. Puberty blockers are medications that delay the onset of puberty and its irreversible changes, such as voice deepening, breast development, or facial hair growth. Hormone therapy involves taking hormones that match one's gender identity, such as estrogen or testosterone. Surgery can involve procedures that alter one's genitals, chest, or facial features. Gender-affirming care is not a one-size-fits-all approach. It is tailored to the individual needs and preferences of each transgender person, based on their age, stage of development, and informed consent. It is also not a cosmetic or elective intervention. It is a medically necessary and life-saving treatment for many transgender people who experience gender dysphoria, which is the distress that occurs when one's gender identity does not match their assigned sex at birth. Gender dysphoria can cause severe psychological distress, such as depression, anxiety, self-harm, and suicidal thoughts. According to a 2015 survey by the National Center for Transgender Equality, 40% of transgender adults in the U.S. have attempted suicide in their lifetime, compared to 4.6% of the general population. The same survey found that transgender youth who had access to puberty blockers were significantly less likely to attempt suicide than those who did not. Gender-affirming care can alleviate gender dysphoria and improve the mental and physical health of transgender people. Numerous studies have shown that gender-affirming care can reduce depression, anxiety, suicidal ideation, and suicide attempts among transgender people. It can also improve their self-esteem, social functioning, and quality of life. Additionally, gender-affirming care can prevent or treat some of the medical complications that can arise from untreated gender dysphoria, such as osteoporosis, cardiovascular disease, or infertility. Despite the overwhelming evidence of the benefits of gender-affirming care for transgender people, especially youth, some states have enacted laws that ban or restrict this type of care for minors. Florida is one of them. In May 2023, Governor Ron DeSantis signed into law a bill that prohibits hormone-related therapy to treat gender dysphoria in minors. It also bans gender-affirming medical procedures or surgeries for minors. The law also bans the use of state money for gender-affirming care and places new restrictions on adults seeking treatment. Florida's law is the only one in the nation that was passed not by the legislature but by the state's medical boards. The law has been challenged in court by the parents of 3 transgender children who argue that it violates their constitutional rights to make medical decisions for their children. They also contend that the law is based on misinformation and prejudice against transgender people, rather than scientific evidence and medical standards. The law has been condemned by major medical associations, such as the American Academy of Pediatrics, the American Medical Association, and the Endocrine Society, which have issued statements supporting gender-affirming care for transgender youth and opposing any legislation that interferes with it. The ban on gender-affirming care for minors in Florida has devastating consequences for the mental and physical health of trans kids who need it. It forces them to go through puberty that does not match their gender identity, which can cause irreversible harm to their bodies and minds. It denies them access to a treatment that can reduce their risk of suicide and improve their well-being. It stigmatizes them as abnormal and unworthy of respect and dignity. It isolates them from their peers and communities who may not understand or accept them. It puts them at risk of harassment, discrimination, and violence. The ban on gender-affirming care for minors in Florida is not only cruel and unjust but also dangerous and deadly. It is based on ignorance and fear rather than science and compassion. It harms trans kids who need gender-affirming care and hurts their families who love them. It goes against the core principles of medicine, to do no harm and to respect patient autonomy. It must be repealed immediately. The ban on gender-affirming care for transgender minors in Florida is a harmful and discriminatory policy that creates a hostile and unsafe environment for trans kids in schools and communities. Here are some of the ways the ban affects the lives and well-being of trans youth and their families. The ban denies trans kids access to essential and life-saving medical care that is recommended by professional associations such as the American Academy of Pediatrics, the American Medical Association, and the World Professional Association for Transgender Health. Gender-affirming care, such as puberty blockers or hormone therapy, can help trans kids alleviate gender dysphoria, improve mental health, and reduce the risk of suicide. The ban violates the rights and autonomy of trans kids and their parents to make informed decisions about their health and identity. The ban also interferes with the doctor-patient relationship and exposes healthcare providers to criminal penalties for doing their jobs. Some parents of trans kids have filed a lawsuit against the ban, arguing that it is unconstitutional and infringes on their privacy and equal protection rights. The ban sends a message of rejection and stigma to trans kids, who already face high rates of bullying, harassment, and violence in schools and communities. The ban also fuels transphobia and misinformation among the public, making it harder for trans kids to find acceptance and support from their peers, teachers, and neighbors. The ban isolates trans kids from their families and forces them to either hide their identity or leave the state to access gender-affirming care. The ban also affects trans kids who have already started gender-affirming care, potentially causing them physical and emotional distress if they have to stop their treatment abruptly. Some families of trans kids have considered moving out of Florida to protect their children's health and happiness. The ban on gender-affirming care for transgender minors in Florida is a cruel and unjust attack on the dignity and rights of trans kids and their families. It is not based on science or compassion, but on fear and prejudice. It is not only harmful to the individual well-being of trans kids, but also to the social fabric of Florida as a diverse and inclusive state.